Most people think about reflux as being caused by too much acid. And actually that's not the fundamental problem. When we swallow, food goes through, obviously through the mouth, then down through the esophagus or gullet into the stomach. Now the stomach secretes acid, hydrochloric acid and lots of other substances which are really, really corrosive. And if you put gastric acid on the back of your hand, it will burn it. So the stomach has all sorts of clever mechanisms to protect itself, but the esophagus doesn't. So normally there's a valve at the bottom of the esophagus which stops food and acid and other things from the stomach regurgitating or refluxing up into the esophagus. So when we swallow, the food will go down, the valve will open, the food will pop into the stomach, and then the valve will close behind the food to stop the reflux. Now, in GORD, or gastroesophageal reflux disease, the valve fails, and that's the primary problem. So, when you've got gravity on your side, you're standing up during the day, most people tend to experience less problems than when they bend over or at night time. So, the options really fall into three categories. The vast majority of people will change their lifestyle, and they'll change what they eat, they'll change when they eat, reduce alcohol or modify the things that they eat in order to try and prevent their symptoms. But that doesn't work for many people, and it's the next step usually is to take these high dose antacid drugs. The PPIs, proton pump inhibitors, and omeprazole is one of those. Across the world, millions of people take these drugs, and they're very effective antacids. But the problem is not only do they have some potential side effects, but also actually probably 20 to 30% of people who take them to cure their reflux still get their symptoms. And the reason for that is it's not actually addressing the fundamental problem. The valve, it's not fixing the valve, so that's why you continue to get the regurgitation symptoms. So it's in that group of patients who potentially could benefit from surgery.